Welcome back to my YouTube channel. On today's topic, I will be discussing about pressure ulcer, otherwise called bedsore. Okay, so I must make it clear I am not a doctor, but I just wanted to bring you vital information that will help you in your everyday life to take care of your family member that may be bedridden and cannot move any at all. This affects persons mostly within the hospital after doing a procedure and they cannot move. They have to stay in one place, or at a nursing home that is not being turned regularly, or at your own home, because you do not know that if you don't turn your family member regularly, these kind of things can happen to them. They can get all different kind of sicknesses on their body. Okay, so today I'll be telling you a little about bedsore, not a lot, but if you want to get further information, you can visit Chrome and you can go to the hospital first, and also you can visit YouTube where other persons will discuss further on this topic. But as this is very important, that if your family is experiencing a bedsore or having a bedsore after I've discussed this and you understand it, please ensure you take them to a hospital or a clinic so that they can assess the situation and see what further measures they need to give you before you start doing anything on their skin. Okay, so a bedsore or pressure ulcer is damage to an area of the skin caused by constant pressure on the area. You hear that? That is very vital information. Pressure on the area. So a bedsore will easily break away. Your skin will break away if you stay on that area too long, if you cannot move yourself. If you can move yourself, it will be a different thing. But if you cannot and you are in one position for too long, your skin can break away easily. Okay, so constant pressure is on that area. So you'll be laying on that area, that one side, for too long. Not only that, so sitting down on that in that one position for too long. Whether you're in the wheelchair or you're on the bed, wherever you are and you cannot move and you're in that position for too long, it can cause your skin to break away. This pressure can lessen blood flow to the affected area, which may lead to tissue damage and tissue death. Bedsores are caused by pressure. Another information, pressure against the skin that limits blood flow to the skin. Limited movement can make skin vulnerable to damage and lead to development of bedsores. And this mostly occurs in persons being in one place for a long period. So once more, if you're in one position for too long, it can cause a bedsore. Okay, so there are different stages of bedsore. There is stage 1 to 4. Stage 1, this is when your skin just begins to look a little red, or you might feel a little hardness of the skin, and you might feel you're a little pain there, not much, but you might just feel a little tingling, like something is there. Just like when a mosquito bites you and you feel a little tingling, you might feel that area feeling a little way. So that's how you know that a bedsore might comes on. So at this stage, it is important that you start to use your creams, and like your Desitin, your A and D cream, or your Suda cream. There are many others that you can get at the pharmacy, but those are the ones that I currently am recommending to you. And you can also ask your doctors about others that is out there, but those are the most common ones that persons often use. So at stage 1, as soon as you feel that or you see a little redness in the area, please go and check it out. If it's your family, please check it out. Don't wait until it has spread to another stage before you start to check it out. And this is a picture of the stage 1 pressure ulcer. So now stage 1 looks. Let us move on to stage 2. So at stage 2, the skin actually breaks away. It will not be a lot, but the skin is breaking away. So at this stage, it is very important that you go to the doctor. So if you did not go to the doctor at stage 1 when you saw the little redness, or you weren't that concerned about it because you didn't know what it was, at this stage, that when you have seen that the skin is breaking away, it is important to go to the doctor first before you start doing any home remedies. So the stage 2 is the breaking away of the skin. So the skin has opened, or you might see a blister on the skin. And this is a picture of stage 2. Okay, so stage 3 is a little more intense than stage 2. The skin will actually be breaking away more. The surface will get a bit bigger and deeper than stage 1. So always remember, along with the doctor's advice, always remember to turn the patient regularly as long as you see that they have a bed sore. But the doctor will inform you of this. As I said, this information is just to let you know what a bed sore is, as a lot of persons do not know what it is because they weren't taught about it, and it's not really highlighted until it has happened to their family or their relatives or friend. So at this stage, it is important to turn the patient regularly. Do not keep them on the side that the bed sore is. If it's on multiple sides of their body, well, probably it will be a bit more difficult, but try not to keep them on the side that the bed sore is. Try to turn the patient frequently. Ensure that the patient has clean sheets to sleep on the egg crate mattress. They have an egg crate mattress and all of those things. And when you go to the doctor will inform you on how to dress the person, or if they have to visit the clinic on a regular basis for the dressing because of the stage that it is in. This is a picture depicting the stage 3 pressure ulcer. Stage 4 is the last stage of the pressure ulcer and is the most deadly stage of the pressure ulcer. Now this means that the skin has been severely affected and a large wound is present. Now this wound needs intensive care. So as I said, when you go to the doctor, they will inform you on what to do, whether you should get additional medicine for them, or whatever treatment, whatever cream they need to use, they will inform you or tell you what to do. So at this stage, remember, do not keep the person on the side that is affected. Please ensure that you turn the patient regularly, at least every 2 hours. That is very important. So if you're taking care of your relative or a friend, please ensure that all of these things are taken into consideration. You turn the person regularly. Ensure you have an egg crate mattress. Ensure you bathe the person properly on a daily basis to prevent further spreading or anything like that. So these information are very important regarding bed sore. But please, people, remember, before doing anything to that person that you see as a bed sore, please go to the doctor so that they can do their proper assessment first before you administer anything to them. At stage 1, when you just see the blister, you yourself can administer the desitin or the A&D, because there is nothing there. Because once a patient is bedridden and cannot move, it is important for you to use those creams. So you don't have to go to the doctor for them to give you those creams. They sell at the pharmacy, they sell in wholesale. So it's upon you to go and get those creams. Once from your family or your friend is not moving and they're in one position, these are some preventative methods that you can use before they actually catch the bed sore. And you can also ensure that you turn them regularly, so to prevent them from catching the bed sore. So people, once more, this is a very vital information for you guys, so that you can know what to do in case of this happening to any of your family members. So as usual, love you guys. Peace and have a wonderful day. Mwah.